welcome to another episode of Caffeinated Coverage Talk with Todd and Michelle. And you are in store for another special guest and a dear friend of ours, Mr. Joe Krivelow with Compass Health Consultants. Welcome, Joe.
Welcome, welcome. Thank you very much for having me today, guys.
Yes,
Welcome, my
yes.
friend.
You're a busy man, so I'm glad we could actually get you on one of these episodes.
You got to schedule it a couple weeks out, but no, it's been incredibly busy, but that's a really good sign. So, no
It
complaints
is.
on me.
Yeah, absolutely. So before we dive into the questions we have prepared today, we always love to start with what type of coffee do you like? Do you drink coffee?
I do. I drink coffee. I have a cup of coffee every morning, and I've got my little mug here.
I love it.
I I love Hawaiian coffee. It is just
Ooh,
so smooth. I like one little fake sweetener in there, a Splenda or something like that, and that's it.
that's
And
it.
I'll have a couple cups a day, unfortunately, but it keeps me going.
I love it. Well, especially this time of year, a pumpkin spice girl. And so is my beagle, Nola Grace. And Starbucks knows us by name. So they will have a pup cup ready for her. And they know I'm going to order something pumpkin spice. But I have to share this with you guys. My dad got me this, and it says, no talkie before coffee.
That's funny.
I like it.
Yes.
I got a real quick story for you. So my girlfriend Amber and I have an iguana. I've had the iguana for um for a long time, for about 16 years. And
Holy moly.
Amber will take the iguana's name is Chicken. So Amber takes Chicken to Starbucks and they love Chicken. And so they all come to the window and they feed him blueberries. It's
That is
it's
awesome.
it's quite a trip.
I didn't even know iguanas can live that long.
Oh yeah.
Yeah.
Yeah, so
hmm
15 to 20 years in captivity is their typical cap, but yeah, he's been my pet forever.
He's pretty
Oh
good
my.
size too. I've seen him on Facebook before. Is
Yeah,
he
he's
like,
he's about 5.5 feet. Yeah.
he's a big
Oh
boy.
my gosh. Now he doesn't sleep in bed with y'all, does he?
Well, when I'm out of town, which is often, he sleeps in my spot in the bed.
That is
That's,
awesome. That is absolutely awesome. Oh my gosh. All right, Todd, what about you? What type of coffee you like?
I'm kind of a Dunkin' Donuts guy. I mean, I'll drink any kind of coffee, but I like Dunkin' Donuts, a little bit of cream, a little bit of sugar. And today I'm drinking out of my Compass Health Consultants cup.
There you go.
Yeah. I got,
Well done. Well done. All right.
mm,
Well, our listeners are excited for this conversation because there is a lot of talk on the streets about LifeX right now. And gosh
mhm.
darn, excitement is building daily, Joe. So
Yeah.
but I hear sometimes people say, I've heard so much about LifeX, but what is it? So can you give us just a brief summary of what we're looking at?
So interestingly enough, the people in our industry talk about LifeX and they love to sell it, but LifeX is actually not a product. Okay. LifeX is a research corporation. And the way that it translates into what we're doing is that people actually join LifeX as a research associate. So they'll answer a few questionnaires throughout the course of the year, because what LifeX does is they study people that are relatively healthy when they join the program. They don't have to stay healthy, obviously, but when they join the program, in exchange for answering some questionnaires throughout the course of the year, two great things happen. Number one, they get paid. So LifeX pays them $40 an hour. Each question is like 15 minutes, but they get paid each time they do it. And then they get access to LifeX's incredibly rich group health benefits, right? So people in our world, whether it's realtors, truckers, accountants, attorneys, hairdressers, doesn't matter, have always wished that they had access to group benefits, because that's kind of the holy grail of the best benefits that you can get your
Yeah.
hands on. And so it gives all the people that we've been talking to traditionally access to those group benefits through the LifeX program.
Wow.
Fantastic. And Joe, there's so many products on the market nowadays, health insurance products. Why would a customer, why would they want to consider joining LifeX Research?
Well, there's a couple things. So first and foremost, LifeX has a dual mission and a dual purpose, right? So number one, LifeX studies all these relatively healthy people to find out what they're doing to be healthy. Stress mitigation and diet and quitting smoking and those sorts of things. Um, but the biggest reason for all of the study is to help people with to maintain their health and for longevity, right? So there's that purpose, but that LifeX is really driven by. But on the other side of it, the reason that most people join is that they have incredibly rich health benefit plans at pricing, that nationally, LifeX employs folks in 42 different states. So in 42 states, people can get access to their health benefit plans. That you know Traditionally they're not going to see plans this rich, and they're certainly not going to see plans this rich at that price. you
Yeah,
know
Hmm.
and I was just reading online about, every year the pricing goes up for open enrollment and it's just gotten astronomical. Oh my gosh. It's to the point people can't afford to have insurance, but we know as working in this industry, you can't afford not to have it.
Hmm.
On some of the ACA plans, you'll see 9 to 18% rate increases just on the premium. And with what's going on in our government at the moment, some people will see, 90, 100% increases because their subsidies will shrink or disappear. In the LifeX program, on some of the programs, there'll be no rate increase. On some of the others, we have a 2 or a 3% rate increase, and that's it. So, that stability also comforts the research associates as well, that hey, I could afford this last year. I'm actually going to be able to afford this next year and feel pretty darn good about it.
Joey, I was talking to one of our broker partners last night, and he has a lady that's one of his customers. She's on the ACA. She's paying $1,200 a month for coverage. It's going to go up to $1,700 a month for coverage. He's going to add her to Life Extra. It's like 500 some dollars a month. He was tickled to death. Yeah, it
It's
was.
amazing, right?
Mm-hmm.
And the networks are much better than what you would ever see on an ACA
Good.
plan. The national
Yes.
networks, they get access to all the best doctors and hospitals, and all those different things are really important. Fact of the matter is that in our world, so many people have become accustomed to having coverage that they don't actually like because it's all that they can afford. And
Mm,
what
Mm-hmm.
that's
LifeX
key.
with LifeX, what they actually um, are able to accomplish is that they actually are getting the plan that they would want for the money that they're spending.
That's good. That is so good. So, for our listeners, which mainly are insurance brokers,
Mhm.
sometimes we like to try to put a square peg in a round hole, and that doesn't fit. So, who is the ideal customer for LifeX? Because they're looking at their book of customers, and I'm sure there's a gazillion they could put into it for open enrollment.
For sure. And so our best customer is, so they're relatively healthy. And when I say that, people say, what the heck does that mean? There's a list of medical based questions that people have to answer to be able to qualify for the research, right? And those people are relatively healthy. And sometimes people will say, well, how do you bring people onto a job? Because it is a job. They get paid as a W-2 employee,
Yeah,
right? So ADP processes their payroll just like they would if they worked at another large organization. Um, but they have to answer those questions to see if they qualify for the research, right? Once they do that, and those are, guys, those are typically pretty major things. Like, do you have heart disease or cancer in the last 5 years, autoimmune disease, liver disease, those sorts of things. If they don't have that, and they don't get a significant subsidy on the ACA, they're a great client um, for LifeX. They don't have to be a 1099 or a W-2 or anything like that, because they're joining LifeX as an employee.
got
So
it.
what their current status is doesn't matter, right? And the beauty of it is, that it's not going to affect what their status is at another employer or anything like that. People are allowed to have two jobs, especially, it's going, and it's not, the employment isn't going to cause some sort of taxable event or change their tax status or anything like that, because they're working so incredibly part-time. We're talking about you know, 60 to 120 minutes a year, right?
Got it.
So
Mhm.
it's
Mhm.
not it's not going to materially change their income.
Mhm. Fantastic. Joe, our partnership with you has been absolutely spectacular. It's been fantastic, and we're very grateful. But can you maybe share like how it would benefit other brokers in the industry to partner with you?
You know, from a broker standpoint, and as we call them, recruiters, you know, because they're recruiting people into the job opportunity, um, it's really accomplished two important things. So number one is it's given people a place to bring their clients, to show them where they can get truly what are some of the best, richest benefit options that are out there, while serving a purpose and helping with those research studies and those sorts of things, so they feel good about it. And you know, the as an employee, your employment doesn't have a pre-scheduled end date or something like that, like maybe a short-term medical plan would. So as long as you are, you know, performing your job duties, you keep the plans, stay on your benefit plans, as long as you're an employee, as long as you want, right? The other part of it is, and this is important to every single one of us, the compensation structure is very generous and it's level. All right. So
Ooh.
being a level recruiting fee schedule means that the broker that brings people on, they're going to get paid the same in month one as they are in month 13, as they are in month 30. And so the more and more research associates you bring into the program, you are literally just building your monthly salary as it grows. And we've had some incredible success stories with brokers or recruiters to us, um, making significant income, you know, 10, 20, 30,
Life
50.
changing.
Yeah, I mean,
Mhm.
some research associates, you know, making real money every month that people would love to be earning on an annual basis. You know, it's pretty it can be pretty significant, if you're bringing the right people into the organization to participate in that research.
Yeah, I love that. I've known you 7 years now, Joe. You couldn't get rid of me if you tried. And I love Compass Health
I haven't
Consultants.
tried yet.
I know, yet. We'll see at the end of the podcast.
Right.
But I love all the products because LifeX is just one of the gazillion products that Compass Health Consultants offers. But I also have to give you kudos because there is tremendous training for your agents. You truly are hands-on,
Yes.
resource filled to the brim for your agents. And that is what people are looking for. People that work in this industry don't want to join an FMO that just recruits and recruits and recruits and throws them to the wolves. They want that mentorship, and kudos because at Compass, you guys do that.
Thank you very
100%.
much.
Mhm.
Thank you very much. Honestly, that's been so it's been the driving force for us. So I got a long history in this industry. I've been licensed for over 30 years, and I've been doing specifically health for over 21 years. And when I started back in the industry and went into health, I was just financially inside out and upside down. 3 months from losing my house. My wife at the time had no idea. $124,000 in credit card debt. Couldn't put my kids in my car because the tires were white. You know, that stuff
Mm.
coming through. It was terrible. Um, and what got me through that was that I had a mentor to lean on every single time I had a question. He picked up the phone. His name was Chris Smith. And uh, what that taught me was that, you know, for the people that are in our industry that want to do the work, if you give them the support, um, they can succeed. And so that's the model that Compass has been built on. So when people come in, everybody gets a mentor and everybody has that resource. Not everybody uses it, and that's on them, right? But we will provide all the tools you need to succeed and then some. And we also work really hard to maintain a family style atmosphere. And we do trips and we do meetings all over the country to try to bring people together. And
Love
we
it.
can't force participation, but for those people that participate, they know they're part of something, and we want them to be part of something.
And
And
it pays off.
It
Mm-hmm.
does. I mean, everything that we've done at Compass, you mentioned all the products and the ideas and those sorts of things. We get all of that from agents, right? So
Mm-hmm.
if Michelle has an idea for a program and it doesn't exist in the market, we'll go find a carrier to help us build it and we'll bring it out to the market. But all of those ideas come from the people that we work with that are talking to the customers every day and they say, hey, we need this or we want this.
Yeah.
And so it's that
Mm-hmm.
partnership. My agents work every day with their customers, but my agents know every day that they are my customer and we treat them that way.
Love
Love it.
that.
You
Mm-hmm.
actually listen. Okay, so back to LifeX, the enrollment process. I'm very curious about both on the member side and the agent side. Is it long? Is it short? Is it hefty? Can you walk us through like how easy it is for an insurance agent if maybe they're thinking on adding this for OEP?
The enrollment process is pretty darn simple. So it's on a very common platform called E123.
Okay.
Most brokers that have been around for a while have had some sort of a product on E123. Um, there's the medical questions we talked about earlier. There's a dozen of them.
Okay.
There are other questions as part of it as well, though. So it's interesting. We'll ask lifestyle questions as part of the application process. So, Todd, did you go to high school? Did you graduate? Did you go to college? Did you graduate? What'd you get your degree in? And sometimes people will say, "Well, do we have to ask those silly questions?" The answer is yes. That's their first part of the of
Research.
of the research, right? They're
Yeah.
gathering the data on who they are. So two things on that. Number one, we're starting that research right away, and number two, they're getting paid for filling out the application with us, right? So it's depending on the broker, it's somewhere in the ballpark of 10 to 12 minutes to fill out the application. It gets electronically sent to the new research associate. They read it to make sure that the data is exactly what they had said, and then they hit submit, and the process starts from there. And their employment will start on the first of the next month, as long as we get them get their enrollment documentation in by the 22nd of the month.
So easy on both sides.
Simple,
Very,
simple.
very
That's the
easy
goal.
lift. Mm-hmm.
Yeah, that's the goal.
Joe, on your website, it does talk about research a lot.
Mhm.
Tell us maybe how how's that about that and how the customers are involved with that on the research side.
So the research is, look, it's very valuable. There's a lot of data that exists in our world on sick folks
Mm.
because they use the system all the time.
Mm-hmm.
So we know what they do. There's a lot of doctors information on them. We have all of that information. We do not have sorry, somebody's at my door. And the office door is surely open, but they decided to ring the bell anyway. um, so um, you know the gathering of data is very valuable in the world of what are relatively healthy folks that don't go to see a physician or a medical professional on a regular basis. So we gather that data and we do so by having them answer assessments that are in their, each research associate has their own portal, their own dashboard. Okay. Um, and we want them to answer, we would love them to answer every single month um, at least one of those assessments. And then we aggregate that data. So nobody's personal information is ever sold. But so we'll aggregate that, and that data is learned from. It is sold, but not with anybody's personal info,
Right.
social, and any of that stuff.
It's
Okay.
truly for research. And
It is
you know
truly
that
for research. Yes.
that kind of leads me to LifeX's mission. And when I read this, I loved it. So on your website, it says that the mission is to improve global health through actionable data. I absolutely love that because quality of life needs to be the focus in our society. Shoot, we could do
Mm-hmm.
a whole podcast just on that. Would you agree?
We absolutely positively could and should.
Yeah, it's a big issue, and I'm hearing
Right.
everything you're saying, Joe, and I'm like, holy cow! So, You're telling me that there's actually affordable healthcare out there that's comprehensive. I get paid a little bit to be on it, and I'm helping with research to end a global crisis? Like, sign me up.
That's that, well, and that's exactly right. And it's interesting, for the broker community that we are talking to, it's funny. So many of them on the way in, they say, well, we don't want to tell them all about the other stuff. We just want to show them the health programs and go right there and kind of skip the research and all of those other things. And the funniest part of that is that the client actually feels the way that you do.
Yeah.
They love it. Like, skipping over it is doing everybody an injustice, because the client loves the fact that they are part of something and they're actually helping, and the research actually matters. All of those things, from our experience with the clients, just adds to the overall positive experience that the clients have had.
Hmm.
Love it. Joe, it's hard to believe we're just 2 months away from 2026. Yeah, it's Saturday's November 1st. But as we come to 2026 with LifeX, are there any product enhancements or anything coming up you'd like to share with us and the team?
Well, so we recently launched last month. We recently launched our newest major health program, which is probably the sexiest program that I've seen out there in a decade. And I say that
Woo!
Nice.
um, it's absolutely unbelievable. Our clients will have our research associates. One of the programs that they will have access to through their employment at LifeX is an EPO program, which typically has a negative connotation, but in this instance, it isn't. So it's the Cigna network. Um, their full PPO broad network. Okay. What EPO means in that is they just, unless there's an emergency situation, they can't go outside of that network. But with Cigna being such a broad network, doesn't really matter. But they get access to full unlimited health benefits with really low deductibles. I mean, 500 to $1,500 deductibles.
Wow.
So our clients get access to those benefit plans that they can actually use, full wellness, ACA mandated wellness, all 64 components, your physical and associated testing and mammogram, pap smear, colonoscopy. If you go into, it's a copay based plan. So God forbid, if my client goes to the doctor, they pay a $50 copay, whether it's a primary or specialist or urgent care, whatever. But if the big stuff happens, after their deductible, they're going to pay a copay. So they go into the hospital and they're there for 13 days or 15 days. They're going to pay a $2,500 copay, and that's it. Uh,
Wow.
so the plan itself is just it is a it is incredible, because the type of coverage that they get
Mhm.
for the cost that they get. I mean, the most expensive plan for a 60 plus year old family with a $500 deductible is like 1,200 bucks a month. Whether you're
I
in
need to
New
look at this for my family
right,
because we're switching in January.
right. I
I
mean,
can get you,
you can
I
be
can
in New
send you the
York, you
link.
could be in Texas. It doesn't matter, right? So because it's a national, it's an ERISA based program, because it's through LifeX as the employer, right?
Mhm.
LifeX is the employer on this. Um, and so it's just a wonderful plan. And we have a great TPA that and processes all of the claims, and the insurance carrier behind it. They know what they're doing, right? LifeX is just one of over 8,000 groups that they have that they administer every single day. And so, all of those are employer groups as well. LifeX is just another employer group to them, but they've been a wonderful organization to work with, to be sure. The
Fantastic.
other thing that we have for those members that are participating in the LifeX health benefit plans is we've got an awesome dental and vision program from Humana.
Mhm.
Uh, that I will feel very comfortable saying is probably the best plan that's in the marketplace today.
When I saw when you added the group dental and vision with Humana, I said that is the best group dental plan I've ever seen. And,
It
and
really is.
my, it really is. Mm-hmm.
Awesome. So our agents
Well,
have a lot to look forward to in 2026. Like Todd and I were saying it, we think for everyone it's going to be our best year yet.
yeah,
There's no
I agree.
doubt. And honestly, that starts Saturday. And I say that on November 1st, we will start it enrolling new employees that are going to start their employment on January 1st. So we got 60 days to build all those people up for people whose plans are going to run out at the end of the year. Come join LifeX as a research associate, and you'll have incredible benefits to go forward with.
Love it.
Now, is there still time, even though everything, the craziness starts on Saturday, for agents to contract and still take part in this for this OEP?
Oh, without question. The
Yep.
one thing, the one thing that I will tell the agents, look, we've got a great contracting staff over here, and we'll get you guys up and running quickly as long as you do one thing, and that is respond when you're reached out to, number one, and just make sure you fill the documentation out. But if you guys get it up and running, we will get you trained. You have to do a compliance quiz, which will give you all of the information you need in your training. You can literally be up and running inside of 3 to 5 business days, and that timing is perfect. So get yourselves rolling and become part of this train.
Michelle, that's a great statement what you said. Yesterday, I was having a conversation with one of our broker partners who loves LifeX, the Cigna EPO, and was making comments. But we were talking that, yes, it's open enrollment period time, and it's, a lot of work is done in this couple months. But with LifeX, it's evergreen. You'll be able to add customers every month, that can join the group plan. So this is a year-round project, not just open enrollment. And that was a big value add for him too. That
Yeah, that's correct. I mean, look, we can hire people all year long, right?
hmm
Just like any employer can, and we do. And so that's an important part of the program.
hmm
Well, Joe, we can't thank you enough for joining us. We know how busy you are, so we truly appreciate this. But, there's so much talk about LifeX. So for our listeners, you are missing out, y'all. You need to get on this bandwagon, and it's not too late for this open enrollment. So contact Todd and I. All we do is submit your information. It takes about 1 minute. And then, as Joe said, within 3 to 5 business days, you're already up and running. So this is something you want to add to your portfolio because people are thriving on this, both on the customer side and on the insurance broker side. So, Joe, you are the best. We love our partnership with you, and thank you so much for joining us today.
Thank you guys very much for having me. It's been great, and everybody have a very happy and a safe Halloween. And thanks, guys.
Yes,
Thanks, Joe.
cheers.
Appreciate it, brother. Cheers. Thank you, brother.